Hi, I'm Dr. Mikkel Jarman here with Pediatric Foot and Ankle, here today to discuss toe walking in our children. This is an 11-year-old boy that presented to the office for evaluation of his chronic toe walking. He's had for his whole life. He's exhausted all forms of conservative care with the splinting, this bracing, casting, physical therapy, and the watch and wait has not resolved his toe walking. He has a very severe form of we call Equinus. This is a gastroc soleus equinus. You can see in the back of his legs, his calves, they just look massive. This child actually has an anatomical variation that has inhibited the lengthening or inhibited the natural lengthening of his Achilles over the years. So any child after the age of 8, we typically are making strong recommendations for interventions. And this is because the reality is most of these children have these anatomical variations that are not allowing their Achilles tendons to lengthen. And we just do not see significant resolution after those ages. So after 8 weeks post-operatively here, he's walking. So typically we do 4 weeks of a cast, 2 weeks in a boot. And here we are surgically. The right leg has been done. The left leg is going to be done today. The right leg, one of the things we're going to notice about just in a passive motion here, you can see there's so much more range of motion. As I dorsiflex his foot, I got easily 15 degrees, whereas here on the left, he's still like -5, 10 degrees. It's just locked out. So surgical indications are failure conservative care, age, severity, and typically these kids have an anatomical variation. So we remove that, we lengthen the tendon. I'll put these kids in a cast for 4 weeks, then I'll put them in a boot, and then they start to walk. 1 foot's done at a time. Here this child is 6 months out, and this is typically the graduation point. So we see the surgical incision sites, they look excellent. They're pretty much faded out. You see he has looks like some grass there on his heel. And I'm going to ask him to stand on his toes, and this is just to display that he still has normal strength. He can still run, jump, do normal kid activities, but the desire to walk on his toes, that's actually disappeared. He can now just do normal activities. So the range of motion is good. He's doing a heel-toe gait. He does not have pain. He does not have fatigue like he did. He did physical therapy immediately post-operatively. Here you can see this again. This is before surgery. This was every day of this child's life, and now that we fixed it, he has a normal gait. If your child toe walks and you'd like to explore a pathway to correcting their toe walking, whether you're local or out of state, feel free to give our office a call. We'd love to help. I'm Dr. Mikkel Jarman. Thanks for watching.